Days before many children will be taking off their masks in school, two studies say Pfizer's COVID-19 vaccine for children may not work as well as parents and doctors had hoped.
Channel 4's Amanda Harry talked to infectious disease specialists to help parents understand the new data.
These are kind of conflicting studies. I think we can say that the effectiveness goes down with time.
UCSF infectious disease specialist Dr. Monica Gandhi breaks down new research that says protection from the Pfizer vaccine may fade faster and more dramatically in children under 12 than in any other group. The first study was from the New York Department of Public Health.
The effectiveness of the 5 to 11-year-old vaccine against reinfection declined dramatically during the Omicron surge. Actually, it went down to 12%.
A different study was released by the CDC.
It showed that there was a decline, but it was nowhere near that dramatic. Essentially, 2 doses of the vaccine is not that protective against infection. I think that's a fair way to put the summary of the studies.
Both Dr. Gandhi and Dr. John Schwartzberg, professor of infectious diseases at UC Berkeley, agree that the vaccine still has benefits.
The vaccines are holding up still very well in terms of protecting against what's really critical, and that's hospitalization and death.
Dr. Gandhi says there are 2 reasons she believes the children's vaccine is losing effectiveness more quickly than the adult one.
One, it's a lower dose, and it wasn't high enough. And the second is that we never should have given it 3 weeks apart. We always should have given it 8 weeks apart.
She says she's been suggesting more time in between doses for months.
And I did this for my children, and actually I've written 2 MedPage articles since saying, yeah, we really need, especially for children, 8 weeks between doses, and now the CDC has agreed.
Dr. Schwartzberg is encouraging people not to listen to politicians or public figures, but to talk to their doctors.
I think parents need to talk to their pediatricians about the value of these vaccines.
Amanda Harry, Channel 4 News.